Good morning to all of you. Welcome here to Uppsala Castle. Shh. Good, it works on students and you. So, my name is Maria Knutson Wedel. I'm the Vice Chancellor of the Swedish University of Agricultural Sciences, one of the partners in Uppsala Health Summit. And I must say that I arrived in Uppsala a little more than 4 years ago, and participating in the steering group for Uppsala Health Summit was one of the tasks. At the first meeting, I wondered, what is this? What am I doing here? I wondered about the purpose. And I have to say that it grows on me. During those 4 years, I can see that Uppsala Health Summit is something different. When we read on the homepage, it's a commitment. And the commitment is not only to share knowledge, but to be more active and proactive. It's to find the solutions that we can act on. It's to drive positive change. And the idea and the aim is that your insights, your personal insights, your discussions here during these days will make a difference. It has the potential to play a critical role in policy making, in shaping research agendas. And it's a collaborative effort, because the challenges we face, they are complex, and wicked problems need a broad discussion and collaboration. So after those first meetings, now I think it's cool. It's something new, it's something different. And how do we make it happen? Well, yes, depending on the year, we are 6 to 7 partners. And we have a fantastic group, which you will meet during these days, every year. They're keen, they work hard, and they are knowledgeable. They jointly work across the borders here in Uppsala. And in the broader perspective, it's called Uppsala Health Summit, but I see that Uppsala is growing now to include more and more. So now we have to call it the Mid-East Summit soon. So one of the most interesting things is the meeting where the committee, the steering group, discuss what are we going to do, what are we going to talk about next year? To finding the right challenge that this summit can attack. So, what competence do we have in common? Do we need someone else on board, a new partner? Can this challenge be formulated? Would it be useful to discuss it during the summit? And will it be attractive? Will people come? And I'm happy to see that there are so many that find this topic, this theme, interesting and worthwhile to discuss. And something else that is really interesting is not in the beginning, it's in the end. Last year, I walked into the room where the dinner was in the evening. And the room was sort of vibrant. Because during the whole day, people have exchanged so much thoughts and discussions and talked so much. So I can feel that something had happened. I met them in the morning and I met them in the evening, and there was a different bunch. So I really hope that will happen today, that you will be arriving to dinner completely exhausted and vibrant, with new knowledge and new ideas. So I will not talk for long. But to conclude, I will briefly mention this year's theme, chemical pollution and One Health, from reactivity to proactivity. It is a difficult topic, and I'm not an expert. I'm a physicist. But I remember as a child the first time in school where I heard the word dioxin. I remember the first time I read about mercury and young children. I remember the report in the 90s when I was expecting my first child, and I read that in some parts of the world, the mothers, they do carry their child in the womb for about 1 week longer because they are exposed to chemicals, which is not very helpful. So after reading Silent Spring as a young university student, I decided that I'm not an expert, I'm not a chemist, but I will stay in academia and I will teach. And I included the effects on environment in all my courses. I integrated in the knowledge the students should bring. So I would say that it's a small effort, but it shows that we can all do something. No matter how small it is, it's the joint effort. So we know that the effects of harmful chemical exposure, it's long-term. But the need for action is urgent and short-term. So if we're going to address the triad of One Health, of humans, animals, and environment, we need to talk now. So please, for the sake of all of us, work hard today. And good luck with your effort. And I hope to meet you this evening completely exhausted, bringing a lot of new ideas and knowledge to take proactive action. So thank you for being here.
Hello, and welcome to the Uppsala Health Summit 2023, and also to Uppsala Castle and this magnificent Hall of State, the scene of many coronation parties in the past, and the place today that we are gathered to talk about chemical pollution and One Health. My name is Robert Watt. I am the Engagement Director at Stockholm Environment Institute, and I am the moderator for the summit today and tomorrow. It's a real great pleasure to be with you here today. Something I'd like to confess before we go any further is that I don't have a PhD, I'm not a chemicals researcher, and I do struggle sometimes even to say pre- and polyfluoroalkyl substances. Bear with me. But my role here is really to try and draw the threads that connect the different parts and plenary discussions and speakers that we have here today, to make those connections with you, hopefully to ask some intelligent questions and give you the opportunity to interrogate our speakers on stage. And then obviously, most importantly, to keep time and make sure you don't miss out on coffee. There are a number of taglines to the summit. Chemical pollution and One Health. And Maria actually mentioned One Health to us, this combination of trying to look at both human health, environmental and ecosystem health, and the health of animals, and look at them together and understand that complexity, but also to grapple with the fact that they are interdependent and entangled. And entanglement is also a feature of another important aspect that we will try and grapple with over the next couple of days, which is this triple crisis in climate change, in nature, and in pollution. These three are entangled, and so there is ample opportunity for us to try and understand those interactions that they have, but also to understand how they're entangled at the level of economic activity of those regulators, some of which we'll hear from over the next couple of days, and the task that they're trying to do. They're also entangled, particularly perhaps in the case of climate change, both as sources, causes of climate change, but potentially also as part of the solution. We need to understand, therefore, are there trade-offs? Are there priorities to be made? I'm going to invite up on stage the chair of the programme committee, Professor Joël Rueg. Come up here, please, Joël. I'd just like to introduce you to, well, the brains behind much of the ideas here. And Joël, I'm going to hand you the mic. There you go.
Thank you.
And I'm also going to then wave something up in the air here, which is, so you're here in Uppsala, but this isn't just a sort of conference up here, just north of Stockholm. It's really made the national press today. And you are one of the co-authors of an opinion article in one of the main Swedish newspapers. Do you want to just tell us a little bit about this and maybe link it to what you're hoping to get out of the next couple of days?
Yes, thank you. So, yes, just in time, this opinion piece came out last night online and today in print. It was a collaborative effort to write this with a few who are very active or have been very active here to organize this workshop, this summit. And actually, we're kind of already going a bit ahead of what should be the result of these 2 days. We have proposed 3 very important points which should be addressed by the European Union in particular, but globally, more generally, and also that Sweden should take a leading role in this. But I'm sure that we will come back to these points which we have raised here, but also hopefully come up with a long list of new points which we will discuss and offer as solutions for this issue. And I want to also say that as the chair of the program committee, I have largely overseen the growing of this program. And it was really my colleagues who at Uppsala University and at the partner organizations who have organized these workshops and attracted all these people, these important players in this arena. So I would really take the opportunity now to thank them a lot for all their efforts to put this program together, and all of you to coming here. And I'm really excited about these 2 days ahead, and wish you all very productive and impactful discussions and a lot of fun as well.
Joël, thank you very much, Joël. Thank you for the leadership that you've shown to pull together this fantastic program that we have in front of us. Another tagline that I want to just bring to your attention is actually, I'm taking it from Joël's introduction to the conference paper. If you haven't read it, do go and look at it. It's available online. And in that, you talk about the need for the conference and the summit to look at immediate actions and long-term investments. And I think it's worth our while having in our minds these time perspectives in front of us. What are the things that need to be done now, but also think about the much longer term. Next year, there is going to be a very important summit in New York, the Summit of the Future, called by the UN Secretary General. And the Summit of the Future is not only looking at our children, as the film was talking about, it's thinking about much longer term, longer generations. And I think that when I started to try and get myself accustomed to all of the terminology related to chemical pollution, the idea of forever chemicals and future generations really struck a chord. We really need to be thinking not only about what happens now, but also for very long term into the future. The other thing we want to try and do over the next couple of days is move ourselves from insight to action. And the format of the summit is structured so that each morning you'll have a plenary session, and then a lot of the day we're going to be setting you to work in a number of workshop settings. And then at the end of the day there will be a final plenary session. So I am going to stop speaking and make sure that we get straight into our first plenary session. But before I do that, I've got a couple of housekeeping things to say. First of all, toilets, both one level down and on the ground floor. And then, as all good flight attendants, I'm going to make some announcements that in the case of emergency, you will find emergency exits here and there, and do make sure that you check, because the nearest emergency exit may be behind you. It's very unlikely that we'll need this. The last fire at the Uppsala Castle was 321 years ago, so I think we should be okay. And unlike flight attendants, I shall not ask you to sit back and relax. I shall ask you to lean forward and engage as we move into our first plenary session, which is going to set the scene and provide you with a real sort of broad overview from a number of different perspectives. We're going to hear from those who are real leaders in research, but we're also going to hear from one of the world's leading regulators as well. And I'd like to invite our first speaker onto the stage, Professor Leo Trasande, who is Director of the Division of Environmental Pediatrics at the NYU School of Medicine. Leo, you're an expert in environmental health, particularly children, environmental health for children, and the impact of chemicals on hormones in our bodies. Interesting, you're also working on the economic costs of failing to prevent disease. You're very warmly welcome. Please.
It's an honor to be here. Thank you so much. What a warm introduction and quite an intimidating setting to be in. Vasa's castle being just such a grand location for such an important meeting. I thought I would begin with some biographical stories. So I, in some ways, shouldn't be here at all. I'm a practicing pediatrician who got very little information, teaching, education about environmental health as a medical student and pediatric resident. Lead poisoning, air pollution, and asthma. Nothing, not a word about endocrine disrupting chemicals. And it was through a legislative fellowship working for then Senator Hillary Rodham Clinton where I was exposed to environmental health and had my own personal aha moment, a tectonic shift in my own career that set me on the path of studying environmental contamination and trying to help guide what we can do about it in the first place. But to set the stage for this conversation, I'm going to go to my pediatric roots in a way, and I'm going to bring it to 2023. And we face 3 infectious challenges that are occurring at the same time. Some of you have probably heard a lot of media attention to flu occurring at the same time as the respiratory syncytial virus and the novel coronavirus, SARS-CoV-2. Many have called this a triple-demic, in which even though we now have vaccines for SARS-CoV-2, there's concern that there will be yet another wave of infections that will wreak havoc across the globe. I would argue that we are amidst an even more challenging triple-demic of our own. And I'm not trying to be alarmist as I say it. We're losing biodiversity. We're facing epic increases in our climate, perhaps hitting the 1.5 C mark much more quickly than we could ever have imagined. And I'm going to change it from pollution to plastics. And this is a thesis I'm going to push very hard. Much of the pollution, the modern day pollution, not the legacy pollution, that we face today is a byproduct of plastics. Now, what's common to these three challenges are fossil fuel consumption and production. So in the spirit of synergy and thinking about solutions from a complex system standpoint, we really need to think broadly about the multiple interconnected challenges that we face at the core. So allow me to just go through that, but I want to emphasize, am I giving you feedback? Sorry. Thank you so much, sorry about that. I'm going to argue at the end that we have vaccines for the other triple-demic. And there's solutions that are actively being explored today. And we have a leading opportunity to do so much for the next generations to come in the spirit of that video that really got my heart rate up. But we created this triple-demic ourselves. We funded this triple-demic. Look on the lower left, we have subsidies annually of $640 billion a year to fossil fuels that continue to this day. And just to provide some context, the impacts of biodiversity loss due to climate change are not equal. They're decidedly unequal. We're in a high-income country today, but the places where fossil fuel is being consumed are proximate to major reservoirs of the remaining biodiversity that we have left on this planet. And these are in populations that often don't feel like they have the same political power as many of us here in this room. And that to me is quite troubling. It's arguably unethical and decidedly unequal. Many of you probably are familiar with the impacts of climate change on human health. I think you've seen the global temperature change graphs in many shapes and flavors amongst this audience, and you see how it tracks so unfortunately closely to the ongoing use of fossil fuels and consumption of fossil fuels. The effects are many and will reverberate for decades to come. We've put our heads in the proverbial sand, maybe in the proverbial oil, on this challenge. We're not just talking about air pollution and its effects on children's lungs. We're talking about heat and the effects on both ends of the cradle to grave continuum, but also on all of us, frankly. We're talking about early heart disease, early mortality from conditions that normally are thought of as just diet, an unhealthy diet and physical activity. Well, climate change is adding to that, putting us in greater peril. Infectious conditions, now I'm talking more about vector-borne diseases, are likely to increase as a result of increases in temperature in our planet globally. This is just scratching the surface of the broader effects of fossil fuel production and consumption that are at the core of what we're here to address today, I would argue. It's much more complicated than that, but from a root cause perspective, that drives much of what's going on. And when it comes to the work that I do day in and day out, and that's studying the effects of chemicals on human health, it's no secret, particularly when it comes to plastics, that plastics are an off-ramp for fossil fuel companies right now. If you can't burn it, you can make plastic out of it. And you can see the exponential increases, particularly again in low and middle income country-based companies, and in some places government affiliated entities that are producing and consuming plastic as that off-ramp under the guise of, well, we're not going to burn the fossil fuels, we're going to push it elsewhere. That is not a real solution. And just to emphasize the point, much of the polyethylene and polypropylene plastic that you've probably inadvertently or unwittingly used comes from oil and natural gas. And as much as we'd like to think that we're trying to recycle our way out of this problem, we're not. We have only cumulatively recycled 9% of plastic over the lifetime of plastic since the year of The Graduate, the movie that some of you may be familiar with, in which the famous line is, "The future is plastics." But suffice it to say that we need more systemic solutions, and ultimately we need a reduction of our use of plastic. And when it comes to the direct human health consequences of plastic, we're talking about bisphenols used in polycarbonate cans and thermal paper receipts. We're talking about phthalates used in personal care products, cosmetics, and food packaging especially. We're talking about per and polyfluoroalkyl substances, the PFAS, the forever chemicals made so famous in Dark Waters, the movie by Mark Ruffalo. We're talking about brominated flame retardants, which unfortunately are affecting the developing brains of young children, affected an entire generation of American children, in which, due to a California law, brominated flame retardants were added to every piece of furniture from 1975 to 2013, in which the Europeans in the audience can be reassured that did not occur. And so we have a log-fold difference in levels between Americans and Europeans, with consequences for human health that I'll allude to later on in the presentation. And finally, we've seen through disasters like the World Trade Center disaster and East Palestine, the event where a truck with polyvinyl chloride exploded, releasing, heating acutely a large amount of plastic. We've seen dioxins released, detectable in the levels of people living in the communities cited near where these disasters occurred. But let me reassure you, unfortunately, this is not just a disaster-related phenomenon. This is not just a proximity to a hazardous waste site problem. This is a problem that all of us face. Now, the good news is the healthcare community has become increasingly aware of this problem. First, it was the Endocrine Society that I'm proud to be a member of. You can see my lapel today. In 2009, released the first scientific statement putting this issue on the proverbial map. I have to give credit to the Wingspread conference that preceded it, but suffice it to say it was the Endocrine Society scientific statement that was arguably the biggest and first large flag. Soon thereafter, the World Health Organization on the lower left and the United Nations Environment Program put endocrine disrupting chemicals, many of which come from plastics, and I've already explained how plastics come ultimately from fossil fuels, pointed this out as a global public health threat. There was much hand-wringing and debate, but then the Endocrine Society, 6 years after the first statement, came out with its second scientific statement, with 1,331 scientific references, with human health effects directly consequent from exposures. Not just effects of developing brains on young children and effects on populations that I care about, but effects on obesity, diabetes, reproduction, fertility, consequences that run from the entire cradle to grave. My own American Academy of Pediatrics particularly put emphatic emphasis on chemicals unintentionally, intentionally added to foods. The obstetricians on the lower right are already communicating patient-based guidance to reduce exposure to these chemicals of concern. And you can see the World Obesity Federation putting policies to prevent obesity. This isn't a diet and physical activity phenomenon anymore when you're talking about the obesity and diabetes twin pandemics that we face today. And I am glad, but I'm also sad in a way to say that we're probably going to an era where we used to check childhood blood lead levels to a phenomenon where we're going to see organic contaminants become part of the regular clinical workup. The National Academy of Sciences in the United States now routinely suggests, arguably, that 100 million Americans should get routinely tested for PFAS levels due to their proximity to contaminated water sites. So this is becoming increasingly real and increasingly urgent for all of us, and it's increasingly costly. In the United States alone, and in Europe alone, the costs of endocrine disrupting chemicals are 163 billion euro a year, 1.2% of the gross domestic product. And that's based on less than 5% of EDCs, a subset of diseases due to the few chemicals we studied, and a subset of costs due to the few diseases due to the few chemicals we studied. So that 1% of GDP is an underestimate of an underestimate of an underestimate. And forthcoming, I'm happy to communicate that we'll be documenting the percentage of these costs that are ultimately related to plastics as well. In the US, the costs are higher, $340 billion. That's due to that unfortunate event where we added brominated flame retardants to every piece of furniture, much of which is plastic, by the way, polyurethane foams in particular. And this is something that also kills us. We did a study documenting that 100,000 Americans die each year due to phthalate exposure and resulting cardiovascular mortality in 55 to 64-year-olds, with $40 billion of societal costs each year. So, and I'd be remiss if I didn't mention that PFAS were not part of these estimates. We've just done a study documenting between $5 and $63 billion of additional costs due to the non-stick chemicals, just based on 13 conditions for which the evidence is the greatest. So we continue to scratch the surface of a more and more costly problem that someday will be on the global burden of disease estimates, because it needs to be. It needs to be side by side with lead and air pollution and all the other contributors. And there are some estimates suggesting substantial burden of disease globally in low and middle income countries. 400,000 low birth weights due to PFAS alone. So I'm going to close by going full circle here. So many of you have seen vaccines such as Pfizer and Moderna. I'm sorry, I didn't have a Novavax picture to add to this deck. These are vaccines for SARS-CoV-2. I'm proud to say that now there's an RSV vaccine that many of us will be taking, that we're just rolling out for pregnant women and children to prevent a serious morbidity associated with bronchiolitis and early respiratory infections in children. Vaccines are wonderful, in my opinion. We have to watch their safety, but so far the track record is extremely strong. I'm going to close by arguing that we have 3 other vaccines lined up. And it's your job to help guide the execution of these 3 vaccines. Now, one of the things I'm going to say, which sets the stage, is that yes, the COP process has been one of those vaccines, but it's only made aspirational goals and set them. What we need in particular with the newest of the 3 vaccines, the Global Plastics Treaty, is we need a conscious requirement for countries to reduce, not reuse and recycle. Because we need to turn off the proverbial tap when it comes to plastic, and it's not really the plastic tap when we're turning off that tap, it's the fossil fuel production and consumption tap. So I look forward to comments on the panel, and again, it's a real honor to be here. Thank you so much.
Leo, thank you very much. You've set the stage magnificently by trying to connect all of these interdependent and entangled problems. And you've really, given also something of a call to action on the Plastics Treaty and the importance of that reduction target. Can I ask you, given the audience we've got here today, we've got workshops taking place, what would you like to see as a result of the discussions here today? What would you like these people in the room really to be taking with them when they leave?
Strategic steps for action and unified action. I think one of the things that I didn't allude to in the presentation is when you get into a treaty discussion, let's say on biological diversity, the biological diversity people show up. We've even seen it to some extent, with all due respect to my colleagues on the Scientific Coalition for a Plastics Treaty. Sometimes we do a really good job within that group, but sometimes people try to separate us from the ocean plastic people to the chemicals people. We all need to work together. The plastics treaty is a chemicals treaty as much as it's a carbon treaty. Don't get me wrong, carbon's at the core, fossil fuels are at the core. But we've regulated 1% of chemicals globally that are used in plastics through Stockholm, through the BRS and through other treaties. We are woefully behind. So it's a strategic plan for action. We have the data. We need to continue doing research, don't get me wrong. I'm a researcher, so I'm going to always say that. So I'm biased, but we need strategy and action.
Thank you very much, Leo. I'm now going to ask our second speaker to come to the stage, Professor Baskut Tuncak. Please come up. Professor, you are the Executive Director of the Massachusetts Toxics Use Reduction Institute. From 2014 to 2020, you were the UN Special Representative on Human Rights and Toxics. And you've looked in particular in that role on the rights of vulnerable groups and chemicals. Very warm welcome to you. We look forward to your presentation. Thank you.
Thank you, Robert. Well, good morning, everyone. Thank you to the organizers for the invitation to be here today. Thank you to Robert for the warm welcome. Thank you, Leo, for making my life a little bit more difficult and easier at the same time. Always wonderful to be with you. So I wanted to speak a little bit today about what I've called the toxic divide. For many years, we've heard of something known as the digital divide, where communities have not had access to technologies that were and continue to be increasingly a basic necessity in the modern world. But today, many communities are living in another divide, this toxic divide, where standards of living do not comport to any reasonable notion or definition of human dignity or equality as we would come to know it today. Part of this notion has come to me through the work I was doing with the UN, where I was traveling to communities around the world and listening to their stories. This was some of the best experiences I had, and some of the most troubling experiences I had, was listening to communities that felt that they were trapped with no choice but to endure what they were bearing. Unquestionably, some of the biggest impacts are being felt today in low and middle income countries. But when we look at the toxic divide, what we can see is that it's also present in surprising fashion in high income countries as well. This is a picture from Sarnia, Canada. Some of you may know Sarnia, but for those that don't, this is where the First Nation of the Chippewas live. That's their ancestral home in the inset, in green. It's surrounded on three sides by chemical plants and oil refineries, which coincidentally are processing tar sand, some of the most polluting fossil fuels coming from northern Canada. This community is incredibly close to highly polluting industries. This is the school for the community, just a stone's throw away from some of these plants, where children are growing up. I would have to mention that Canada has consistently been ranked as one of the countries with the highest living standard in the world by various surveys. In addition to indigenous peoples, minorities, migrants, and other vulnerable groups are often found in this toxic divide. Among those communities, we also see those that are especially vulnerable: children, persons with disabilities, different genders, the disabled, among many others. This figure helps to illustrate how these issues often intersect: social vulnerability and access to basic human rights, such as access to safe drinking water. The squares in blue illustrate those communities that are socially vulnerable and also suffer from repeated lack of access to safe drinking water here in the United States. Flint very rightly made headlines around the world, but you can see that Flint is not alone. And while Europe has been held up as having some of the best environmental standards, including on chemicals, around the world. It has also found itself being exposed to having this toxic divide. Here we see migrant workers who are an invisible part of our social fabric and also invisible to the systems that should be protecting those that are working in essential fields, such as those here, where they are regularly exposed to pesticides. In the mid-1990s, the former UN Commission on Human Rights established a mandate to look at the intersection of toxics and human rights. When it created the mandate and appointed a special rapporteur, it did so with a singular focus to look at the issue of toxic waste, and toxic waste being dumped from the global north on communities in the global south. This was a problem in the mid-90s, and it continued up until right around 2010, when this incident happened, which was a ship or an incident known as the Proba Koala. For those that aren't familiar with this ship, it was essentially a floating factory, where a European company, was conducting an industrial process on board that ship because it couldn't get the permits to do that on land. When it came time to dump its waste, it found that the prices being charged by European authorities too high, so it set sail, first to North Africa, and then to West Africa, where it finally found someone to take its waste. That was Tommy Company in the city of Abidjan, Côte d'Ivoire, where under the cover of night, it took the waste and dumped it around the city of Abidjan, Côte d'Ivoire. 18 people died, and over 1,000 people were taken to the hospital as a result of that incident. In response, the UN Human Rights Council, as it was then formed, recognized that the issue of waste cannot be dealt with in isolation, that this is an issue that requires a life cycle approach, and it expanded the mandate on human rights and toxics to look at the entire life cycle of pollution, of chemicals and waste, hazardous substances, from the very basic raw materials throughout the life cycle up until it becomes waste. And here you can see why this is very, very important, as Leo also emphasized in his remarks. Through the years, the work of several rapporteurs on human rights, and not just on toxics and human rights, but also on safe drinking water, on adequate housing, on the right to food, and many others have clarified how many human rights are actually implicated by our exposure to toxic substances every day. Earlier, we spoke about overlaps between biodiversity, climate change, and pollution. When we look at human rights, these overlaps exist as well and may even be more profound. They often intersect. They oftentimes conflict with one another. But the reality is that human rights are very much implicated by our exposures. We've made significant strides over the past 12 years, I'm very happy to say, in recognizing the right to a safe, clean, and healthy environment as a fundamental human right, culminating with the recognition by the UN General Assembly a few years ago of this right, as well as the International Labour Conference of the right to safe and healthy work as a fundamental principle and right. But these are both long overdue. The Stockholm Declaration recognized the right to a healthy environment in 1972, and the International Covenant recognized safe and healthy work as a fundamental right back in 1968. One of the challenges I see is when we look at these rights, what we don't see is what level of exposure is considered a violation of human rights. With time, what is considered safe has fallen lower and lower and lower. When we look at mercury, when we look at lead, when we look at PFAS, we see that the levels of what is considered to be safe has considerably fallen. And how these human rights will react to that reality is an open question. And meanwhile, the global trends suggest that our exposures will continue to increase. And they will increase upward, especially among the most vulnerable. Many states have conveniently turned a blind eye to the fact of this exposure and the resulting health impacts, despite the fact that their constitutions for years, if not decades, have already recognized the right to a healthy environment. According to the latest figures, over 12 million people will die prematurely around the world from an unhealthy environment. WHO acknowledges that this is an underestimate. We struggle to find disaggregated data, reliable disaggregated data, when it comes to vulnerable groups regarding the impacts of toxics on health. But in some cases, we do have good data. For example, if we look at the situation of workers. The latest figures from ILO and WHO show that approximately 2 million workers will die prematurely every year from exposure to toxic substances at work. So roughly, in the few minutes that I've been speaking to you today, about 300 people will have lost their lives around the world prematurely from predictable and preventable toxic exposures. In parallel with the development of the right to a healthy environment and its subsequent acceptance by the international community has also been the development of a normative framework around the responsibilities of businesses to respect human rights. First codified in 2011 by Professor John Ruggie as the UN Guiding Principles on Business and Human Rights, this movement has now spawned, in some cases, binding legislation in countries requiring companies to respect human rights, while also articulating the framework that's based on the state's duty to protect human rights and the duty of states and the shared responsibility of businesses to ensure access to an effective remedy. When you take both the development of the right to a healthy environment and the normative framework around business and human rights, when you look at them together, what becomes very clear is that in both camps, you see an emphasis on the requirement for states to reduce the use of toxics and the responsibility of businesses to do so. I have seen this, and I think others have seen this as well, including the UN Committee on the Rights of the Child. If you look at their latest general comment on the right to a healthy environment, you can see very clearly that they are emphasizing the state's duty to prevent and minimize exposures to the maximum extent possible, especially for children. Now, I know that both of us have now given somewhat dark projections on the future and what is happening in the state of play of the world today. But I wanted to maybe turn the page a little bit to how we can help to operationalize this and perhaps to give a little sense of optimism for what can be done around the world to address this crisis that we're facing. As Robert mentioned, I work for the Toxics Use Reduction Institute in Massachusetts. And we are a creature that was created by statute back in the 80s under a piece of legislation called the Toxics Use Reduction Act. Now, this act was a byproduct of human rights abuses and violations. Just outside Boston in the 70s and 80s, companies were dumping their hazardous chemicals, their toxic chemicals, contaminating water supplies, which resulted in numerous cases of childhood cancers. Based on this experience, the state of Massachusetts, the legislature, passed the Toxics Use Reduction Act, otherwise known as TURA. Now, TURA, I think, is a good example of how the state and businesses can work together to reduce the use of toxics. Interestingly, TURA doesn't ban or restrict any toxic chemical. It does, however, list hundreds of hazardous substances and classes of substances, including PFAS. To my knowledge, it has the broadest list or class of PFAS listed in legislation today around the world. Based on this list, companies are required to report their use. This use is then subject to a plan that a company must prepare every 2 to 4 years. In this plan, the companies outline what options are available for alternatives and what steps they are taking to reduce the use of the toxic chemicals on which they're reporting. TURI works with these companies to help them assess the alternatives, gives them technical support to adopt the alternatives, as well as financial support when needed. And all of this is paid for by the companies that are using the toxic chemicals, providing an incentive for them to make the switch to safer alternatives. You can see that the results have been quite profound over several decades. The Toxics Use Reduction Act was adopted in 1989. Since then, we've made significant reductions in toxics used, the volumes that are released into the environment, and the volumes that are disposed of as waste. When we zoom in on specific chemicals, we can see that the reductions have been even more profound. So in green, you can see the reductions in the use of trichloroethylene. Trichloroethylene is one of the substances that was responsible for the childhood cancers that I mentioned before in Woburn, Massachusetts. Hopefully next year, we will get to 0 reportable uses, finally. After systematic, concerted efforts over a number of years to reduce the use, working step by step with companies and finding viable solutions and avoiding regrettable substitution along the way. I also wanted to give you just one example of our more recent work, however. Many of you are familiar with PFAS, or AKA forever chemicals. We were approached by a company in Massachusetts to help them develop an alternative for PFAS that's used as a surfactant in electronics. These companies are clients of a company in Massachusetts called Trasande, which sells them formulations which they then use to produce microelectronics, semiconductors, and other electronics. We teamed up with researchers at the University of Massachusetts in the engineering department, and we were able to find a safer alternative within 18 months to the formulation that the company Trasande was using. A safer alternative that doesn't have PFAS chemicals in it. We identified this in 18 months. The safer alternative is 90% less expensive than the PFAS formulation that the company was using. It has been adopted by 95% of their businesses, over 100 clients, including some of the biggest names in electronics today. And all of this was accomplished for less than $30,000. So this is one example. Over nearly 35 years, we have thousands of other examples. And this is just our institute, our small institute in Massachusetts. There are countless institutes and organizations around the world who have also developed solutions to the problems that we face today. So when I hear that our exposure today is an inevitable necessity, an unavoidable byproduct of modern society, I have to disagree. I mean, this is a political choice that we have made. We have the power to make the switch. We have the power to help realize human rights around the world, and we have the power to make sure that we can close this toxic divide, to make sure that everyone can enjoy their right to a healthy environment. Thank you.
Thank you very much, Baskut. So if I've got the number, sorry, that last number blew my mind slightly, $30,000. Am I right in thinking that's like 10 to the power of 5 less than some of the numbers that Leah was talking about in terms of health costs of this? I mean, I've got to ask the question, but why isn't everyone doing this? What's holding us back? I mean, it seems like a no-brainer.
It's a very good question. I mean, I think the experience that we've had in Massachusetts shows very clearly that it's possible. Other people have in the past tried to replicate this model. There have been certain forces that have prevented that. So I believe that the reason that we're not doing this more widely is a question of political will.
Thank you. Let us invite our final speaker for this first plenary to the stage, Dr. Sharon McGuinness. A very warm welcome to you. Sharon, you are the Executive Director of the European Chemicals Agency, and before that, from 2018 to 2022, CEO of Health and Safety Ireland. You have a background in industry, in policy, in academia, so we're really looking forward to a broad presentation from you.
Thank you very much, Robert. Good morning, everyone, and thank you again to the organisers for inviting me here. I have to say I've already listened and learned an awful lot listening to the previous speakers, and as a person, it's very hard not to be moved and provoked by some of the images and evidence presented. But obviously, I'm here as the representative of the European Chemicals Agency, which is an agency based here in Europe. And I want to talk about, I suppose, the work we're doing and we're trying to do to prevent the chemical pollution and indeed many of the challenges we talked about, both in climate and biodiversity loss. And I might just introduce ECHA to you, because I'm not sure if you all know about us. We're one of 35 decentralized agencies in Europe, and we are a regulatory agency mandated by the decision makers in the European Parliament and member states, and we get funding from the European budget and from industry fees. We've been in existence since 2007, and unlike maybe some other agencies out there, we tend to have a double legal basis. So our basis is not just very much the promotion and protection of health and the environment, but also concerns the internal market here in Europe, as well as ensuring the competitiveness and supporting the competitiveness of chemicals industry. And as part of that work and that aims, we're here through the implementing of 10 different European regulations and directives and several different specific agreements with Commission, other agencies and the scientific community. So we're part of a community of stakeholders involved in trying to address all of these challenges that we heard about around health and the environment. And we implement and work through our mandates by both carrying out technical, scientific and administrative tasks, but also by providing consistent, independent and high quality opinions and decisions, which hopefully go on then to inform the policy makers and the political system to adopt and draft union measures. And obviously in all of this work, collaboration both with member states, with Commission, with agencies, industry and indeed civil societies and academics is all part of our role too. And in that regard, I suppose, perhaps two of the more common and maybe well-known pieces of legislation that we have as an agency to implement are two pieces called, one is called REACH, the Registration, Evaluation, Authorization of Chemicals, and the other is called Classification, Packaging and Labelling, or CLP regulation. And I might just talk a little bit about both of them because in some ways they're perhaps the start of the system here in Europe for how we regulate and take care of many of the chemicals that cause some of these, many of these problems. REACH as a regulation has a number of aims. Again, it's a high level of protection of health and the environment. It's to provide for the free circulation of substances on the market and enhancing competitiveness in innovation. It's also there to promote the alternative methods to the assessment, for the assessment of chemicals. And the regulation covers the manufacture, import and use of chemicals and has a number of different elements. So I might just run through those briefly. So registration of substances over 1 ton, per annum. And this requires industry, who we deem here as the duty holders and the ones that should know the most about their own chemicals if they're putting them on the market. They have to provide an increasing level of information to the agency as they're on their substance as the tonnage level increases. And registration will give them market access to the companies for those particular substances. And as a general rule, testing on animals is to provide information on substances cannot be done without without providing a testing proposal to the agency to assess. And as of the end of September, we have over 104,000 registrations covering over 127,000 chemicals and over almost 18,000 companies. So it's a very large database of information. We then have evaluation. That's where the registration dossier is checked for compliance, or where a testing proposal submitted by the registrant is assessed. And that's called this is called dossier evaluation. And member states may also take substances and decide to evaluate it when they have grounds for considering that there may be a given substitute constitutes a particular risk to health or the environment. And we obviously support member states in that work. Now, these are two, perhaps as I call them, very much initial steps in the process for assessing chemicals here in Europe. And then out of those, we should be able to determine what, if anything, is needed further to take account of the chemicals, particularly of the particular hazards, and how we might risk manage those. And the two main pathways for risk management in REACH are called authorization and restriction. And authorization is where substances of very high concern, and this is where we have the carcinogens, the endocrine disruptors, the persistent chemicals, and those with equivalent levels of concerns cannot be used unless they're authorized for a particular use by a particular company for a particular amount of time with a view to their eventual substitution. So there are presently about 59 chemicals on the substances of very high list, and they will result in the companies under obligations in terms of reporting, but also if added for authorization down the line, they'll have to apply for an application for a particular use if they want to continue it. Restriction is the process whereby a substance or a group of substances, for example, where it's deemed there's an unacceptable risk across Europe, these are either banned or restricted for manufacture use or placing on the market. And I was interested that a lot of the chemicals mentioned in some of the slides earlier, many of them are already restricted here in Europe or have been or will be shortly fully restricted, and I might come back to that in a moment. There is another piece of risk management legislation called the Classification, Labelling and Packaging Regulation, which identifies the hazard of a substance. And obviously, depending on the nature of the hazard identified here, then that chemical could be banned for particular use. For example, right now, if a chemical is classified as a carcinogen, a CMR, it is automatically banned in terms of consumer use as a substance or mixture. It can, if it's particularly classified as well in some of these hazards, be managed in a particular way under occupational health and safety legislation, or indeed may not be allowed to be used in downstream products such as toys, cosmetics, etc. Now, many of you probably are aware that in December 2019, the European Commission published its EU Green Deal, and that was, of course, a very ambitious plan for Europe to tackle many different challenges. And a key pillar of that particular deal was the zero pollution, and under this umbrella, the Commission published a chemical strategy for sustainability, which sets out a number of actions under different areas. These include around innovating for safe and sustainable chemicals, strengthening legislation, simplification and coherence, knowledge and science, and global. And some of these key actions within the strategy include the introducing a ban on the most harmful chemicals in consumer products by allowing those chemicals only be used where their use is essential, paying attention to the cocktail effects of chemicals when assessing chemical risks, phasing out PFAS in the EU, again, unless use is essential, boosting investment and innovation capacity for the production and use of chemicals that are safe and sustainable right from by design right through the life cycle. Establishing a simpler, what we call one substance, one assessment process for assessing the risks and hazards of chemicals, and playing a leading role globally by championing and promoting high chemical safety standards, not just here in Europe, but also worldwide, by not exporting chemicals banned in the EU. Now, that's a very big brush, and obviously the Commission are the policy and drivers and makers in this case, and obviously as an agency we are working with them and supporting them in the role of that in terms of either implementing any change to legislation but also supporting any policy developments with information and knowledge as well. And I might just talk a little bit about some of the areas of focus coming both from the CSS but also from the agency's own perspective, which might inform you about your discussions today and maybe show some of the areas that are of relevance for how we might tackle chemical pollution and health in the future. So in relation to existing legislation, the Commission has already prepared a number of proposals, including the revision of the classification regulation, which is currently making its way through the EU decision-making process. Now, that proposal to amend the CLP regulation to take account of new hazards such as endocrine disruption, persistence and mobility will ensure these hazards are centrally and clearly identified. And then that would allow further action to be taken under more specific or relevant legislation downstream. Bringing all that hazard identification into one place will also bring greater clarity to the hazard identification across all legislation and allows regulators and stakeholders to take more appropriate action. And it's some way going forward with the chemical strategy drive for a one substance, one assessment. In other words, that's the aim to address inconsistencies in hazard identification between different types of chemicals because of their particular use. So whether you're an industrial chemical, a biocide or pesticide. And right now, EDs, endocrine disrupting chemicals, for example, are regulated in REACH, regulated in biocides, regulated in plant protection products. So you have 3 different pieces of legislation which can identify an ED, as opposed to being in where it should be, which is around the CLP for proper hazard classification, therefore being used elsewhere, then we can take account of how to use it. The Commission, again with our support from the agency, is working to bring these new hazards into the globally harmonised system, which, as you know, drives the CLP and vice versa. And that's with the aim that all EDs, PBTs, persistent mobile toxic chemicals and all those hazards should be identified in the same way globally. Now, my own view is chemicals don't do borders. I've never seen a chemical stop at the border, and what changes at borders is regulation and identification. And so if we want to address some of these far-reaching problems, it is really important that we just not look at this in our own particular regulatory area, but also look at it at the broader global level as well, because an ED is an ED. A carcinogen is a carcinogen, and it just doesn't matter where that is if we have and start with a single piece of identification for those hazards under the GHS. Now, with respect to the REACH regulation, I'm sure you're all very well aware there's been a lot of discussion on that, and we are currently working closely with Commission colleagues, providing input and advice on how we can perhaps change the legislation and revise it in the future based on experience, but also a need to drive and increase maybe the speed and the efficiency at which we take decisions on particular chemicals. And that work is still going on. But I might just say that we still have a lot of legislation right now, and I think we always need, and I suppose being a regulator and somebody who's been in that role for a long time, it's very important we don't lose sight of what we have now with the view to keep looking ahead, because there's a lot right now we have that needs to be fully and properly implemented, and that's what we as an agency are aiming to do. It's the full implementation, and that implementation of current legislation requires not just the agency, it requires member states, it requires industry and all the different stakeholders to play their part. So in relation to the current legislation, the Commission has already developed a number of, rather taken some specific action, and that includes, for example, a restrictions roadmap, which is to show the progress and to outline the progress they want on restricting the most harmful chemicals, groups of substances. And that restriction roadmap is there to provide a balance between the need for flexibility on when and how to act, but also while securing progress on restricting these most harmful groups of substances. And the aim of the roadmap is also to increase transparency. And one of the challenges I think we often see is, you know, companies will say we need predictability or certainty, and you can see, okay, that's fine. However, it's also important people realize we are going to target things, not just today, but in the future. And can they start to consider how, as you say, to design out and to stop using these in advance of any regulatory action? And again, this roadmap is there to help stakeholders anticipate and consider future action that might be taken on the particular substance. We are doing a number of assessments here in ECHA under what we call Article 69.2 of REACH, and those are assessments are for substances currently listed for authorization in Annex 14 of REACH, to see if the risks from those substances are, when they are contained in articles, are controlled, because at the moment authorization really follows to the use. It doesn't address the actual substance of very high concern in a finished article, for example. And we'll be constantly working and publishing these as we go on into the future. You might be aware that this year one of the more significant restrictions agreed is the one on microplastics, and that came in just there last week on the 17th of October. The aim of the restriction was to prevent the pollution from intentionally added microplastics, and it concerns synthetic polymer microplastic below 5 millimeters that are organic, insoluble, and resist to degradation. Within that restriction, and this is probably what Europe does, we do a lot of time-limited derogations, but certain things are already addressed as no longer possible, such as, for example, glitter. That's already prevented because, why? There are safer alternatives. It doesn't prevent you using glitter, but there are more safer alternatives out there. And it's hoped that this will prevent the release of 500,000 tonnes of microplastics over the next 20 years. And we in ECHA, we produced the dossier, and together with our committees, provided the opinion that formed the basis of that particular decision. Maybe in the last few seconds here, talk a little bit about some of the elements in the chemical strategy which might be useful for the conversations here today, but also are useful for those that are in the business of producing chemicals or thinking about chemicals in the future might want to consider. Again, the idea of grouping, that's really talked a lot about in the chemical strategy. And I suppose the first thing is, it's interesting, and one of the challenges I think worldwide, and even probably amongst this room, is we tend to use a lot of terminology. But my version of what a group is and your version of a group is probably is very different. So we see the benefit, and we recognize that one of the steps that can increase efficiency in opinion making and decision making is to address groups of chemicals rather than each individual chemical, because that probably has been the way we've done it for some time. As an agency, we're already using a grouping to help us map what we call the chemical universe, but also to identify and screen for all the chemicals on that database, over 100,000 as I mentioned, for possible regulatory actions in relation to those groups of chemicals. And we're now working with member states to determine how we can group chemicals together for risk management purposes. So that could be for identifying a chemical, a particular hazardous property, or for taking a restriction if necessary. And certainly on restrictions, you will all no doubt have been well aware of the current universal PFAS dossier, which has been submitted by colleagues from Denmark, the Netherlands, Germany, Sweden and Norway. That universal PFAS proposal is a good example of grouping of substances together for regulatory action. It's also a good example of collaboration with member states and ECHA to bring that forward, but also is addressing very much the CSS target to look at PFAS substances in general. And that work is ongoing at present. And as you know, if we've to deal with all the challenges and all the problems we just saw there, taking individual substances one by one is not really going to get us there perhaps fast enough. So grouping has to be part of the conversation. And as I said, in order to group, obviously we need to then make sure that the legal and the legislative basis that we have allows us to take that fully through the process. Another reason for grouping and looking at things is to prevent regrettable substitution. And we know when, for example, when bisphenol A was identified in an SVHC, unfortunately, instead of people, they moved to the next bisphenol in the group, so bisphenol S. And therefore, we want to prevent this type of action. So by taking the whole group of substances in a single regulatory action, that's important. I also think industry also needs to realize that even if you have one substance in a family that is regulated, simply substituting with perhaps another substance in that group may be meeting the letter of the law, but perhaps not the spirit of the law. And it's again that idea of your choices as industry. What do you want to do in order to address it? And do you as well look at it much more broadly in the concept of what are you doing to contribute to the overall goals of health and the environment? I'm going to be in the workshop on testing, and perhaps one of the aims of REACH is, as I mentioned, to promote the alternatives for the assessment of hazards to chemical substances. And we've obviously done a lot of work in that regard here in ECHA, and we'll continue to do it into the future as well. But under the CSS, reducing the need for animal testing is highlighted, and it's there to both improve the quality and efficiency and perhaps the speed of chemical hazard and risk assessments, as well as protecting and preventing animal testing. But we all know that testing on animals has been our cornerstone for legislation for hazard and risk for many years. And therefore, at the present, this goal of reducing animal testing certainly for industrial chemicals might be a difficult one to seem to achieve, particularly as we need to speed up on hazard assessment and maybe risk assessment of chemicals. However, with the increasing calls from citizens, from NGOs and industry and others, there's an onus on us all to start looking into that space and to see how we can work together to determine how we can use those particular new methods, novel alternative methods, both to deliver the goal of reducing animal testing, but also to speed up the process and still have the same high level of protection of health and the environment that we all strive for. Another aspect is data, and we talk a lot about data in today's world, and it is a really important part for us as an organisation. But we have to have access as a regulator to data that is relevant and usable in a regulatory context. And I know that can be frustrating for people because they go, but we have all this information. But as a regulator, we are bound by the regulation, and therefore some of the information or data that we have, while it's great to capture, we obviously need to make sure that we also have the data captured. We're getting the knowledge out of that to take real tangible action that can last the process of opinion making, but equally get into decision making at the end of the day as well. And we also need to have the most up-to-date information available, and that's where obviously industry are always being reminded that, you know, when you know your chemicals best, and you need to keep that information, certainly in registration dossiers and elsewhere, up to date and up to speed, so that we can do the best job we can in terms of analysing and using that information. And there's a huge amount of data out there, and it comes from lots of different perspectives. So you have regulatory, environmental monitoring, you have occupational hygiene, academic, etc. But turning it into knowledge in a consistent and, as I said, faster way is a challenge for us all. And mentioning earlier, you know, an academic study can be really valuable to advance the science and the knowledge, but using it in regulation may be a challenge. And we've seen that this difference between academic studies and regulatory needs is a challenge, and part of ECHA is part of the work with PARC, which is a partnership for the risk assessment of chemicals, we're looking to address. And we recently published a report on key areas of regulatory challenge, which highlights the regulatory areas where it is still difficult to assess using current tests or understanding. And we would hope to and aim to report these on a regular basis, so that academics and other researchers can see where the issues are and perhaps help us resolve them and provide the research or study needed to address. In terms of, as I said, the one substance, one assessment, you know, again, the idea behind that is a single place for assessment, but equally a place where regulators as a whole can work together. And that is why, you know, that concept of one substance, one assessment is very important. And with the change in CLP regulation, we hope to be able to achieve that. And as I said earlier, the hazard of a chemical doesn't change just because it's used in a different way. It is there as an intrinsic property. And from my own experience over the years, each piece of legislation or regulation is important, but each needs to be seen in the context of how they are implemented, not only by the regulators, but the industry and others too. And a challenge perhaps for addressing chemical pollution in One Health is how to ensure that all regulations that deal with chemicals work in tandem to achieve the ultimate aim of protecting health and the environment. So, you know, we all have our different pieces, but somewhere we have to bring them together as well. We have a very strong drive for governance and transparency, but we understand, and this is important because the public need to trust the work that we deliver on. But we do recognise that collaboration with all the relevant stakeholders is important, and that includes industry, civil society, academia. But collaboration, in our view, should never and does never stop us making and taking the right regulatory action when we need to. So I think that's a really important thing. It also we need to look at the competence. Those challenges are big, and as I said, the days of us all being trained as a toxicologist, as a chemist, as a what, we are now going to need a much more fluid type of competence and experience, and, you know, putting the call out there to academics to think broadly. How does the world work, and how do chemicals get used, so that we can use all of the different disciplines in a coherent and consistent fashion. And I might just close a little bit on the global perspective, because there was a mention there, but we're not directly involved. That's obviously the global area for Europe is done by the Commission, but obviously we're there to support it. And we just recently had the ICCM5 meet in Bonn, and I think just on Friday they published their advanced material. And again, it's that recognition to try and bring this at a broader level, because we can regulate chemicals here in Europe, in the US, in Australia, Canada, wherever, but chemicals travel. Unfortunately, sometimes in the wrong way, but they travel, and we need to recognize that to address all of these challenges, it needs a global driver. And again, I mentioned the work that's been done under the globally harmonized system, for example. So while it might seem as if tackling all of this is quite challenging, I think, you know, if we do work together, we can develop the science and generate the knowledge to address the challenge of chemical pollution in One Health. It won't take one person, it won't take one organisation, but I think collectively, and looking here in the room, I see a huge interest in the topic. And I know in ECHA and myself, we're very much want to be part of that. And as I said, we will play our role as a regulator, but we will also try and support the work of the research and the other disciplines and thinking around how do we address chemical pollution and the wider issue of health, not just for us as individuals, but for our planet too. Thank you.
Sharon, thank you very much. I brought up this newspaper article again just because I think you'd find it really interesting. Obviously it picks up the REACH and the chemical strategy for sustainability. I'm glad to say that there will be translated copies available to everybody at some point. I'm looking to Mickey. A coffee break.
Excellent.
Very soon in that case. So this is required reading for everybody in their coffee break. A quick question to you, Sharon. You talked there about the importance of having a broad view, but also of ensuring coherence in our policy frameworks, and also in the way in which we apply our research expertise. It brought mind to me what Leah was talking about the importance of having a strategy that looks across and is coherent across a number of different fields, whether it's nature, chemicals, or climate change. To what extent does ECHA have the opportunity to look not only at chemicals, but think broadly about the interactions and the interdependencies, perhaps, with, in particular, climate change?
Yeah, I mean, it's something actually, it's close to my heart, and we're in the middle of developing a new strategy for the agency for the next 5 years. And what we're trying to do is bring the regulatory aspect, which we have to deliver on, but also look at the challenges of how do you advance chemical safety through research, through knowledge, and we're never going to solve it 100% on our own. We need collaborators and cooperators in Commission, in member states and agencies and elsewhere to make this happen. So I know myself, I'm always trying to figure out the connections to things, and my history is kind of broad. I've probably went into different places, and I'm a real believer in the legislation you have. It's very hard to get perfect legislation, and I probably shouldn't say that, but as somebody who's been there and I've written it as well, I know it's always tough because when you start to implement, you start to see the gaps. So the key for all of us is to see where those gaps are. So my legislation will do X, your legislation will do Y. How do we bridge that gap? How do we make sure that there is a connection? Because industry are looking at all of these and manufacturing, importing and using them. And we as regulators and stakeholders need to start seeing, well, how do they all fit? So can we see how they fit now to address these challenges, and to see then, could we strategically think about, if we want to address chemical pollution, where do you start? And as I said, the challenge looks big, but maybe by thinking a little bit more, where could we get maximum impact for all of our efforts, I think will be a good opportunity.
I know that we've got coffee very soon, and I shan't hold you back too long, but I do want to give you in the audience the opportunity to ask a question of the panel. I think we'll have opportunity for maybe 3 questions. There are microphones in the audience. Please stick your hand up for a concise question to the panel. While you're thinking of your question, I'm going to ask one of my own. So do think of a question, pop your hand up, please. But Leo, you presented us with your sort of 3 alternative vaccines, and obviously vaccines themselves have a number of ingredients in them.
Yes.
Baskut, you mentioned political will. Political will must be one of those ingredients. Leo, can you give us some of the other key critical ingredients that you see need to be there to make progress on those vaccines that you presented to us?
Sure, we need technological innovation as well, don't get me wrong. I mean, and there are companies that are already showing leadership in using alternatives, as Baskut already alluded to. There are ample examples that exist, and often the barrier is that the company that is doing things the old way is the one with the larger market share than the company doing the right thing with that smaller market share. And the question is how to transition that in a way that doesn't create well, there's let's just be honest, there's substantial resistance in the companies that have that market share and want to keep it that way. But I think to be clear, at a societal level, there's not really a loser. It's at that individual company level. So I think that's important to keep in mind.
Baskut, do you want to add anything to that in terms of like the ingredients that you see alongside political will that are really critical?
Sure. I mean, I think the point that Leo made is very good, because many of these companies that are out there have built up economies of scale. It's difficult to overcome those economies of scale without the benefit of regulation to help bring the newer technologies, better technologies to the fore. But I think one of the examples I would bring is the example of the Montreal Protocol, which is held up as one of the best international laws that we have. Unfortunately, it was developed in the 80s, and we've been on a downward trajectory since then. But nevertheless, I think one of the key challenges I see both in the BRS conventions, the Basel, Rotterdam, Stockholm conventions, as well as the emerging plastics treaty, is this issue of conflicts of interest, which some of us were discussing a little bit ago. And, you know, I think if we look at other fora, certainly health-related, but not necessarily the environment as we're speaking about it. If we look at the Framework Convention on Tobacco Control, one of the interesting things that convention has done is to prohibit the participation of tobacco companies, big tobacco, in those negotiations, recognizing that there is an undeniable conflict of interest between those companies and what is needed globally and what is being discussed in that forum. And I think that's really interesting. I mean, I don't know if that's entirely the right way to go. I think some companies out there are producing chemicals, but also toxic chemicals, but are also producing safer alternatives, and sometimes their voices can be helpful. But by and large, if you look at the chemical negotiations that we have today, you don't see the downstream users. You see the chemical industry. You see the chemical industry in various forms. And I think that needs to change, because, you know, businesses, just like anything else, is not a monolith. It's composed of many different actors and many different perspectives and opportunities for progress.
I think we have a question here at the front, please. Wave your hand up if you have a question, please.
Thank you, Mikael Karlsson, Uppsala University. Sharon, you talked about REACH. The white paper on REACH came in 2001. It estimated that 1,400 substances should be targeted for authorization. We're not even close to 1/10. That's 2 decades and 2 years ago, 22 years. Now the Commission has promised to deliver a new proposal, and we, in this op-ed, identify some of the key reforms that have been promised. Do you think that we will see a proposal from this Commission during this period of office?
Obviously, it's the Commission's right to make the proposal. At the moment, they had indicated that any proposal that would come would be in Q4 this year. And you've seen the commentary and the discussions in that regard. We're still working with them, I can tell you, every day to give input, so we're continuing as if a proposal would be on the way. And obviously we'll be ready to support it once it's there. On the other hand, we also want to start making sure that we're using the legislation, as I said, we have to drive forward on these things. And obviously the challenge with estimates is, you know, estimates are estimates, and we're probably seeing things, but there are other elements of REACH above and beyond authorization, or indeed with CLP and elsewhere, where some of them maybe more action has been taken, and it wasn't maybe fully around authorization that we can take the action. And perhaps some of the things we've seen is when substances are added as a substance of very high concern, we don't get applications for authorization. So even that is an indication people are moving away, or not even, you know, they see them coming and they just stop using them as well. So there's different forces at play. Obviously, as I said, the REACH revision, we were working still very closely with the Commission on it.
Question here, please.
Pete Myers, Environmental Health Sciences and Carnegie Mellon University. Sharon, I have another question for you. You mentioned endocrine disruption repeatedly. As I look at that field, and I've been playing in it for 30 years, the biggest scientific obstacle to regulators getting endocrine disruption right is their persistence in insisting that the dose makes the poison. Hormones don't behave that way, and endocrine disrupting compounds don't behave that way either. Low doses can be very different from high doses. You cannot predict low dose results from high dose experiments. When will ECHA get on board that scientific reality?
I think there's, as I said, and I absolutely accept the point that all things work in different ways, and the challenge, as I said, is in regulation at the moment. The system is set up in perhaps the more classical way of hazard identification, but we do recognize there is a lot of new things coming at us, and the report I mentioned about regulatory challenges, it's around those kind of areas. How do you say an ED is the same as, some big, chemical that we all know about, like, for instance, mercury, where it's probably easy to test and find an outcome, but an ED or a hormone-like chemical is more challenging. So it's between us working with academics and researchers to try and find ways, are there different ways to test for these types of endpoints? And how do you then bring them into the regulation to be able to use? And I know the Commission is pushing a lot of different in vitro methods as well, which may be perhaps the area for the future for some of these newer challenges, such as immune issues, such as endocrine issues as well.
I'm a member of the Endocrine Society, and I'm certain they would be delighted to be invited to help you think that through.
And as I said, one of our parts of our new strategy is this idea of advancing the science, and it's probably an area I'd like us to get more involved in. But yeah, we'll certainly, we recognize that's a space that, as I said, as a regulator, we always have to do in accordance with the regulation, which might seem challenging and annoying at times, but we want to also be able to start pushing the boundaries of how do we address these things in the future, because they're here and we need to know about them.
Thank you.
Thank you very much, Pete. Hands are now going up all over the place, and we do need to get to coffee. So I'm going to take another 2 questions. The man in the checked shirt here, and then a woman at the back there. Thank you. We'll take them one after the other. Well, no, we'll take this question first, please. Yes, thank you.
Thank you. Adan Martinez at Swedish University of Agricultural Sciences, Umeå campus. One of the uncertainties also comes on the regulation part, right? Is related to the previous question. You have uncertainties on what the effects might be of certain chemicals, but at the same time, what the effects of a regulation will be, whether it will have an actual positive effect or not. So I wonder how you guys are dealing with that kind of uncertainty on both sides of the equation.
Yeah, I mean, as I said, the uncertainty is there in many different ways. Regulations will, in some ways, they give you a frame and a box to operate in, but but we won't always have everything included in the box, and that's why you revise legislation and you rethink what you're going to do, and that by having it in that box or that frame, it gives us as a regulator certainty about where we need to take action, but it also gives industry and others maybe a certainty as well on where the action might be taken. However, it is, as I said, the challenge is that sometimes things come, usually with regulation, we're often slightly behind. And one of the things, and I think it's from reactivity to proactivity here, I think the idea of prevention is a topic that perhaps we do need to think a little bit more about, because chemical pollution and the issues, and if you look at some of the substances, we may have known about them for some time, or we were aware of them, or we were getting monitoring data or whatever, but the actual action then is takes another route or another period of time to actually happen. So it is, how do we use them both for regulation for the the problem that we have now or the most recent problem, and how do we stop what's going to be the future problem? And in that regard, as I said, I think it's a challenge for us all. How do we get into that space? And that's possibly back to the idea of testing and understanding, but equally, how do you regulate in a faster way, perhaps, for the future?
I think it was a very interesting question. It was something that struck me, that the R's that we keep on talking about, moving to from reactivity to proactivity, but also regulation, restriction, but then what Baskut was talking about, which is actually reduction. And that R, which is the true way of dealing with prevention, is something that's also critical. Last question, please.
Yes, sorry, Judith Lundberg-Felten from Uppsala University. I also had a question about the regulation for future. When you replace chemicals by other chemicals, as we have heard from Baskut, how can we know how these chemicals interact with other future chemicals? And we know now that regulation is coming in as we live with these chemicals and we realize how harmful they are. Some are testables, others will only be like revealing maybe side effects in their context they are used in. So what do you think about the replacement there?
Thank you. Can I ask actually, Baskut, if you could take that first, since you're working so often with this replacement?
Yeah. It's a huge challenge that we face, are the data gaps. Oftentimes we'll find an alternative, but we will find numerous data gaps that don't give us the confidence that we need to recommend that as a safer alternative. It's a huge challenge, and I think it's a systemic problem to our ability to transition towards safer alternatives, is companies don't want to make a regrettable substitution, only to find that 5 years down the road, they have another BPS or BPF or something else on their hands, so they have to retool.
Right.
I think that's a huge challenge, but it's something that we pay very close attention to, and there's a whole school of thought around alternatives assessments and how they can be done and how they should be done. And I think ECHA has been doing a lot of work in that regard too. But certainly from our perspective, a data gap is as concerning as seeing what the hazard is, if not more concerning.
Mm-hmm. Thank you very much for your questions. I won't hold you back any longer from coffee, which we'll find directly outside this room. Thereafter, we will be breaking into our workshops. You should know which workshop you're in. Where you're meant to go is another question, but fortunately you'll find nice people holding up signs which you should then follow to find the room for your workshop. Thank you very much, everybody.